Okay, I'm gonna go ahead and check my provider's orders. It looks like we have ordered to put in an NG tube for Steve Rogers. So I'm gonna go ahead and gather my supplies, which I have right here. And then I'm gonna go ahead and grab some hand sanitizer. Actually, let's see, someone here. Hand sanitizer, we're gonna do some hand sanitizer and then go into the room. Hi Steve Rogers, my name is Brooke Slagle. I'm gonna be doing an NG placement on you today. I'll also be your nurse. Can I just get your first and last name, date of birth? Steve Rogers, 12/25, perfect. And any allergies? No? Okay, perfect. So what we're gonna do, like I said, we're gonna go ahead and do an NG placement today. Basically the reason why we're doing this is because you just came out of surgery, and so we just want to suction up all some that gurgly stomach acid that you're having, and that's going to help a lot with the pain that you're experiencing right now. We're going to start that procedure right now, if that's okay with you. What I'm going to do is I'm going to put like a straw like tube in your nose, and it's going to go into your stomach, and I'll help you along the way know what to do and how to make this a smooth process. So now I'm going to go ahead and do an assessment on you. So I'm going to do my hand hygiene, and I'm going to need some gloves. So I'm going to come grab some gloves over here really quick. Okay, I'm just going to put some gloves on. And I'm going to go ahead and examine your nasal and oral pharynx just to make sure nothing's in the way or there's no sores or anything. Just gonna go ahead and check. Perfect, everything looks great. Okay, and I'm gonna go ahead and just assess your abdomen for any distension and make sure it all sounds right. I'm gonna look, palpate, and also listen. Not in that order, but I'm going to go ahead and do that assessment. It looks like everything is great. So we're going to go ahead and keep going with this. And then I'm going to go ahead and take off my gloves. Okay, do hand hygiene. I'm going to measure this tube. I would grab a new one if this, with this falling. I'm gonna grab no more gloves. Get some tape ready. Okay, I'm gonna prep some tape first. Okay, making like a Y so that we can place it on as a placement just for a second. Okay.
Any specific reason you want to go into nursing or?
Okay. So when measuring this, we're gonna go from the nose to the ear, and then we'll go ahead go down to the xiphoid process. And this mannequin doesn't really have one, but we'll just assume that he's at a 55 here, okay? And I'm gonna go ahead and grab a piece of tape for that and just mark it so we know how far we're going to advance the tube into the stomach. Okay, and I'm gonna go ahead and grab everything. I would put like a towel over just to make sure stuff's not getting anywhere. I'll put an MSS basin for them. And I'm also gonna have you just check with your fingers and blow on each side to check which nair is more clear. This one, okay, perfect. And then I'll go ahead and give you some tissues. You can blow your nose and kind of empty that way. I have an basin here if we need it. I'm also gonna have a cup and water. At one point during this, I'm gonna have you take some sips. This will be when at first we're going to go ahead, we'll just talk about this now. We'll insert the tube and you'll have your head up as we're going through your nose, and then as soon as we hit your oral pharynx, or when you feel like you're about to start gagging, we'll have you put your neck down to your chin down to your neck and take sips, and that will help me further the tube down. If there's any resistance, I wouldn't force it, but I would maybe rotate it a little bit and then continue on. If there was still resistance, I would pull it out, re-lubricate, and then try again. So we're gonna go ahead and I'm gonna get this out as well. My nasal stripper one, need it here. I would now go ahead and test my suction first. We don't have suction, but I would test it, make sure that it's intermittent and that so I'd hook this up and that it's on low and that's not more than that. I could kink it as well just to double check. Okay, and then I'm gonna go ahead and put this in here and make sure it's not, actually I would check the suction after doing this. So I would do this first. So make sure it's not occluded and there's no suction on before inserting the tube. So it's not occluded or anything. We're gonna have it in this emesis basin so that no gastric juices go on the patient or anything. Double check. This is just motion. Okay. I'm gonna go ahead and start. I'm gonna first go ahead and dip this, or I'm gonna spray it. I would spray 3 to 4 inches. Okay, I'm gonna go ahead and have you lift your head up. I'm gonna go ahead and start now if that's okay. And I'm gonna go towards the ear. Okay, perfect. And now we've hit that oral pharynx. Now he's gonna go ahead, I'm gonna have you sip, take big sips. Okay, perfect. And tuck your chin. Okay, this mannequin makes it a little difficult to be able to put it all the way in. So we're gonna simulate it and say that he's all the way in. And we'll go ahead and, sorry, actually this tape, put this tape on his nose. And we're gonna just temporarily anchor it, temporarily. I'm gonna grab some gastric juices. It looks like gastric content right here in the basin. So I'm gonna go ahead and use a syringe out of this first, actually. I can't tell if it's gastric juices yet. It should fit in here. Yeah. There we go. I didn't realize it has a cap on this one. Now we're gonna see, yes, there's some gastric juices, so I'm gonna go ahead and put it in here. It looks right. So I'm gonna go ahead and test it with the strip. Perfect. It's at about a 4, which is below 5. That's perfect. Okay, and then also we'll do a chest x-ray. That's the golden standard for checking placement. So we'll go ahead and do that. As soon as we get it back, it looks like it's in where it's supposed to be. We will go ahead and take this off. Keep that anchored. I would also have the patient talk to make sure I know it's placed right. That's another way to know that it's correctly placed. Okay. Perfect. Now we'll go ahead and hook this up to suction. Now we would check to make sure that it's intermittent low and all the things, and then we'll hook it up and have it on intermittent low. And then Steve, are you having any pain or any problems with this? Any discomfort? No? Okay, perfect. Now educate the patient. And granted, this is like not up, but we would have it up when inserting the tube. We would have the bed raised up to at least 30 degrees. And so I would also let you know, Steve, that we would want the head of bed at 30 degrees at all times now. We are also an NPO status, meaning that we can't have anything by mouth, so no food or water, just while we have this in. Do hand hygiene as I'm educating. And then also just report with any concerns, any bloating, diet, or any like nausea or vomiting or any discomfort, let us know. Make sure that the call light is right next to him. I'll go ahead and lower the bed, and then I'll go ahead and make sure that the bed or the side rails are up and that the bed is locked, and I would go ahead and go just like put away all my stuff and throw away what needs to be thrown away, and document my cares. I would document that we inserted an NG tube, and that if there was any complications we would put that in there, as well as any concerns and what education we did, as well as safety times 4.